It is difficult to say exactly how many Canadians are homeless. However, the most recent statistics indicate that an estimated 55,000 Canadians experience homelessness on any given night, and at least 335,000 Canadians are homeless in any given year. Of that number, it is estimated that 245,000 are using emergency shelters, including women's shelters, 75,000 are being housed temporarily in other types of nonprofit organizations, such as hospitals or by family or acquaintances, and 15,000 are sleeping outside. Homelessness affects many Canadians, though some population groups are more at risk of becoming homeless than others, including single adult men, people dealing with mental health issues or addictions, women with children fleeing violence, and Indigenous people. Adults between the ages of 25 to 49 make up 52% of those experiencing homelessness in Canada. Seniors, 65 years and older, make up a small percentage of the Canadian homeless population, less than 4% of shelter users. However, seniors and older adults, 50 to 64, are also the only groups whose shelter usage has increased over the past decade. What is the leading cause of homelessness in Canada? Homelessness in Canada is a complex issue influenced by a variety of factors that push individuals into unstable living situations. Economic challenges play a significant role, as high living costs, unemployment, and stagnant wages make it difficult for some to secure stable housing. Affordable housing shortages further exacerbate the problem, leading to increased competition and inflated rent prices. Mental health and addiction issues are often intertwined with homelessness, as individuals struggling with these conditions may find it difficult to maintain steady employment or access necessary support systems. A lack of accessible and affordable healthcare services can hinder their ability to manage these issues effectively. Family breakdowns and relationship issues contribute to homelessness, as strained relationships can lead to eviction or the loss of a support network. Additionally, high living costs are a significant contributing factor to the growing issue of homelessness in Canada. The country's soaring housing prices, coupled with rising expenses for essential goods and services, create a challenging environment for many individuals and families to maintain stable housing. The escalating cost of housing, particularly in urban centers like Vancouver and Toronto, places immense pressure on those with limited financial resources. Rental rates have outpaced income growth, making it increasingly difficult for people to secure affordable accommodation. This situation is exacerbated by a shortage of affordable housing options and a lack of effective government intervention. In addition to housing, the overall high cost of living affects individuals' ability to cover basic necessities such as food, healthcare, and transportation. Many low-wage workers struggle to make ends meet, pushing them closer to the brink of homelessness. The vicious cycle is perpetuated as individuals find it challenging to access job opportunities, education, and social services due to their lack of stable housing. A recent point-in-time count conducted for Toronto Street Needs Assessment found that on the night of the 26th of April 2020, there were 10,715 homeless individuals, with 3,618 of them housed in refugee, asylum claimant shelters. Point-in-time counts are sometimes criticized for being inaccurate because they do not fully take into account hidden homelessness, especially among women and youth. Who experiences homelessness in Canada? Indigenous peoples, Métis, Inuit, First Nations, are overrepresented in Canada's homeless population. While they account for 4.3% of the Canadian population, they represent between 28 and 34% of the homeless shelter population. Indigenous homelessness is particularly acute in many Canadian cities. According to its study, on any given night, 6.97% of the urban Indigenous population in Canada is homeless, as compared to a national average of 0.78%. About 1 in 15 urban Indigenous people are homeless, compared with the average of 1 in 128 non-Indigenous people across Canada. In other words, urban Indigenous people are about 8 times more likely to be homeless than the non-Indigenous population. Several Canadian cities count a significant Indigenous homeless population, including Vancouver, Regina, Saskatoon, Winnipeg, Toronto, Ottawa, Val-d'Or and Montreal, where the Inuit population is even more overrepresented. Youth. Youth between the ages of 13 and 24 represent 18.7% of people experiencing homelessness in Canada. A high percentage of homeless youth identified as LGBTQ2S, 29.5%, Indigenous, 30.6%, or as members of racialized communities, 28.2%. In terms of gender, 57.6% identified as male, 36.4% as female, 1.8% as transgender, 1.8% as two-spirit, and 2.5% as gender non-binary. Many were homeless at a young age. 40.1% of participants in a 2020 study reported that they were under the age of 16 when they first experienced homelessness. According to a 2006 study on street youth, this segment of the homeless population in Canada is particularly vulnerable. The prevalence of sexually transmitted infections and bloodborne infections in street youth is 10 to 12 times higher than youth in the general population. They are 11 times more likely to die from suicide or substance overdose. 12 to 32% of them report engaging in sex work, and 45.8% of them have injected drugs. Women. Women represent 27.3% of people experiencing homelessness in Canada. Their experiences often differ from men in several ways. Studies show that homeless women are at higher risk of violence and assault, sexual exploitation and abuse. Many women are among the hidden homeless because they prefer to avoid the shelter system and the streets, even if it means staying in dangerous situations, including domestic violence. Domestic violence is a major cause of homelessness for women, as well as poverty resulting from gender inequality. Several studies show that female homelessness is directly impacted by the fact that women experience more precariousness in the job market, have lower wages, and are more likely to be head of a single-parented family, all resulting in a deeper poverty than their male counterparts. This impacts the kind of housing they can afford, their food security, and their health conditions. Racialized, immigrant and Indigenous women may experience additional systemic barriers, thereby compounding their experiences with homelessness. Mental health and homelessness. Homeless people are more likely to experience mental health issues than the general population. In fact, the two conditions may reinforce each other. Loneliness, social exclusion, and psychological distress often go along with homelessness, and poor mental health contributes to poverty, disaffiliation and personal vulnerability, which in turn can lead to homelessness. Research shows that an average of 30 to 35% of homeless persons, and up to 75% of women, have mental illnesses, and 20 to 25% experience both severe mental illness and addiction. Single adult men. Single adult men compose the largest and most visible population group experiencing homelessness. Single males between the ages of 25 and 55 accounted for 47.5% of the homeless population in Canada between 2005 and 2009. Homeless shelters in Canada. Luckily, Canada's government attempts to fight the homeless epidemic with all their might. A helpful resource available to the homeless in Canada is 24/7 emergency shelters. In Canada, there were 423 emergency shelters in 2019, with 16,271 permanent beds. Some accommodation is specifically for men or women, but around 37% serve both. Aside from these, youth shelters are also somewhat commonplace, making up 22% of all accommodation. Unsurprisingly, 90% of shelter beds are in Ontario, Quebec, Alberta, and British Columbia, with 44% located in Ontario. The City of Toronto has tried to tackle homelessness with varying results so far. However, the city provides shelter space for approximately 6,800 dispossessed, spread across 75 permanent and 26 temporary sites. Some of these sites were added as part of the 2021-2022 winter plan. Moreover, Toronto has the most extensive shelter system in all of Canada. However, recent developments have unfortunately pushed back the solution for the homeless population. As homeless encampments grow across Canada's biggest cities, officials have been slow to react. Individuals are being uprooted and dragged around without a long-term residence, and nothing seems to be changing for the better, since the road to affordable housing seems long. Moreover, Toronto has released new data showing that 40 people a night on average are turned away from homeless shelters due to a lack of available beds and are left on the streets. Advocates condemn the government's inability to provide a real solution for destitution, and rightfully so. Strategies to address homelessness in Canada. Many nonprofit organizations have emerged to answer immediate, mid-term or long-term needs of Canada's homeless population. It is commonly agreed that strategies to address homelessness must be tailored to each population group's needs. Emergency shelters may target specific subpopulations, including men, women, families, youth or Indigenous persons. They often provide shared sleeping facilities, although some offer private rooms. Some expect clients to leave in the morning. Different shelters may have varying policies regarding alcohol or drug consumption. Some shelters offer mid-term housing solutions, allowing people to stay for weeks or months at a time. Others have developed long-term housing units. Some shelters offer food, clothing and other services, such as laundry or references to other appropriate services or organizations. Other homelessness nonprofit agencies provide services such as counseling, legal assistance, harm reduction and advocacy. Other approaches, such as social housing with community support, have been promoted to offer a more durable solution.